energy level is up, sleeping is good. I feel more comfortable eating foods I never really ate a lot before.
You mentioned the muscles in your thigh down to the feet are being normalized. So if we're looking, comparing before and now, when you first came, there was a lot of irritation in the back, with irritation traveling down that left lower limb.
Down the right. Sorry, left.
Yes, it was the left, right?
Correct.
So tell me now, compared, how are things coming along for you? Is the back pain still there? Is it better? Is it worse?
The back pain is much better.
In what way?
I have more flexibility, forward, sideways, and backward. I have better muscle control, better recovery on my muscles, legs and upper.
Excellent. It was going on for a long time, right?
Hip, yeah, it had progressed over a period of 2 or 3 years.
And now what is better for you? What can you do now that was difficult before?
I have better flexibility and energy to stretch, to move, to recover, and spinal mobility seems better.
How has that made a difference for you in your day-to-day?
Outlook is brighter. The feeling of positive feelings, energy level is up, sleeping is good, appetite is good, forward view is much better, more positive.
That's good. We have been looking to improve the quality of that nerve signal going from, well, start generating from the brain, going down that spinal cord, exiting and going down your legs, which is very different from a physical medicine. That's not what we're doing. We're not doing a therapy here. It's to improve the quality of nerve function in your body so that your body operates better. And at the same time, we want to balance the body, balance the brain centers, balance the body so that everything is working better.
Yes.
So there were a lot of other aspects and facets of health which are affected in that. Now, I want to notice you mentioned things like with the digestion, the appetite. You mentioned your craving and the food. What has changed in that? What have you noticed there?
I feel more comfortable eating foods I never really ate a lot before. Hamburgers, French fries. I'm very picky in what I eat.
Yes.
I feel I can eat more volumes today, but I have the energy level to work out more during the day, and my appetite for drinking fluids is very high. Obviously it might be the summertime and workouts, but in general it feels good, and I don't have any issues, from an intestinal standpoint or from a bowel movement standpoint. I feel cleaner in that sense. I can make easier bowel movements. Not that it was difficult before, but I have more sensitivity for that.
So that's a good sign. And you've noticed that since the onset of care, we've been in our aim of balancing the body and restoring complete nerve function. You've noticed that change with regards to the digestion, the intake of food. Right?
Yes.
You're saying, yeah. That's it. And do you see that as a good sign?
Yes, I do. No, the hamburgers and the French fries, probably not, but the ability to work them off is a good thing.
Sure. Yes, and of course, so the fact that the palate is opening and you are open to other foods that maybe you were more dismissive of, that's a good sign that you're able to make that choice now.
Mm-hmm.
And you said in terms of your day-to-day activity, was working out difficult before, and was it more of a challenge before, and now
it wasn't necessarily a challenge. It was a motivational issue. During the pandemic, I sat for hours on end in my office, like most people, and I didn't do enough stretching or enough physical activity because it was to a degree painful. My hips, my lower back, etc. Now I've noticed progress that I can do that, and once I feel progress is there, and the motivation then increases. So I feel instead of doing 100 body squats, now I can do 300.
Wow.
Or instead of doing 20 push-ups, I can do 30 more often. So my energy level is very high.
And again, you feel that is related to the improvement in the spine and the...
I believe so. Yeah. I have no medical background for that. All I know is I feel better now than I did when I came here.
Perfect. And that's what it's all about,
Quite simple.
Theory, science, it's all great, but at the end of the day, it's all about results, right? And we're definitely going in the right direction. You also mentioned, as we look here, that in your neck, the muscles in your neck and the muscles in your body and in the pelvic region with strength, you said you have better rotation, and in your arms it's more, the change is noticeable. Well, what is noticeable in your neck?
Just the feel good of movement.
Compared to before? Well, how was it before and how is it now?
There's more flexibility, okay? There's more strength due to doing it more. The recovery period is quite good. I don't have sore muscles after a workout. And I'm able to do it more as a lifestyle than as a targeting 1 hour to work out and then stop. And for me, it's 24/7, and I feel motivated to do it more.
Great. You mentioned the muscles in your thigh down to the feet are being normalized. And what have you noticed there? You said on walking you've noticed.
Yeah, my gait on my left foot is supinated. I've been supinating for years on that side because of a weak left deep six muscle structure in my hip. So I've been able to strengthen that more, knowing I can work out further and work out more. So that strength has increased down my left leg. And so my thigh, my hamstrings, my hip rotation, deep six muscles are stronger. I still have to work on my ankle and my supination. So my number one goal now is to improve the left big toe and second toe strength, where my gait can then come off of supination into pronation.
Again, in our attempt to balance the body and get health up to 100%, get you functioning, feeling great, functioning great, we've also been trying to balance those elimination zones as well. And
sorry, balance what?
The sinuses. Yes, balance the elimination portion of the body. And what is that you've noticed with regards to drainage? You said you'd increased levels, drainage more in the evening.
Yeah, I've just noticed it. I've always had to a degree a runny nose, being here in the Middle East. I think that has to do with sand in the air to a degree. But my mucus has freed up, not a huge amount, but I notice drainage in the evening. Just yesterday or the day before, in the morning I noticed it. So that seems to be improving.
Perfect. And one thing that we noticed a lot, and I'm glad that you mentioned this, was people, despite being a hot country, people still feel that their water intake isn't sufficient. What do you feel after our corrections? What do you think has happened? What change have you noticed there in terms of your water intake?
I've always drank a lot of water, but with my increased workouts and activity, I've taken on more water than relative to my increased activity. So the taste of it's cleaner. I'm more apt to now have a glass of water at dinner versus either milk or a Diet Coke or something like that. So it's just it's more awareness.
Overall,
I don't count the number of ounces I drink a day. I just whenever I get close to it, I drink it.
Sure. Rounding off then, in the few weeks that we've been together then, how would you say that the experience here, or the overall result has been compared to other methods that you've tried? Because I know before we met, you had tried a lot of different avenues. You were searching a long time, and when I first met you, I saw it in your eyes. You were, in a way, it was tough. You'd been really looking for solutions. And how do you feel in comparison? How do you feel things have been here with us?
I've taken a different approach here, in the sense of I didn't look at the spine and you correcting that and freeing up those nerves could have the impact that it's having. So where I came with a lot of questions, and I generally ask a lot of questions, I have let the process just flow here and take heart of what changes I've seen in my performance as a body and a system. So instead of, my main concern was okay, the muscles in my hips, that sort of thing, but also the bowing out of my lumbar spine. And I thought that, how is that going to affect me further on? And I was more focused on one or two things. Now it's more of a, I guess, holistic type view of the body, and saying, take what you have and move within that. And if that feels good, that's progress.
And overall, the end result, would you say that this is positive for you? Do you feel things are...
Yeah.
Do you think it's been...
So far, so good.
Yes, yeah.
Very positive.
So, because sometimes we get people who've been suffering for a long time, and sometimes they're unsure, or What would you advise to somebody if they were in a similar situation as you? Would you advise them to come and?
Yeah, I think they have to have an open mind and give it a test run, give it a trial, and see how the body feels, and then make the choice what's right for them.
Well, thank you for sharing. It's your body is improving, and it's a whole lot better compared to how it was before. Mm-hmm. And I look forward to getting this all fixed up. Doing perfect. Thank
Sounds
you.
good.
Great. Let's check you. Let's have you lie face down, please. Tell me, what's most tender? Number 1, number 2, number 3, number 4, number 5, number 6.
I would say 1, if anything, but it was hard to tell the difference between the 6.
And it's very hard now, huh? So it's balancing well, huh? Coming along.